Hello, I'm Chesley Richards, CDC's Deputy Director for Public Health Scientific Services, and thank you for joining us for this installment of Conversations on Public Health Surveillance. Today we're joined by John Beltrami and Violanda Grigorescu. Welcome, and thank you for joining us. John, what do you do here at CDC, and how did you get to CDC?
I'm an HIV epidemiologist, and I work in the prevention program branch, and my main responsibility is to use my scientific skills to help make prevention activities at the local level the most effective and impactful as they can be.
Terrific. And Violanda?
I am currently branch chief for the Partnerships and Evaluation branch in the Division of Health Informatics and Surveillance in CSELS. My role is to use the knowledge and skills I gained over the years and to oversee the work performed by the branch staff.
Terrific. So how did you get interested in surveillance? And let's start with John.
Well, this is my 25th year in public health, and I've had a lot of great opportunities in surveillance, including my very first assignment when I worked in the state of Louisiana on their congenital syphilis surveillance database and making recommendations based on my analyses. So surveillance has afforded me a lot of great opportunities. I've had a lot of wonderful mentors, so I've appreciated this field.
Terrific. And Violanda, what about you?
I share the same, long experience in working in surveillance and loving actually the components or the parts of surveillance from data collection to application. And I actually like more the application part of it, and I look in the future for this cross-collaboration and changes that healthcare reform brought to us.
Oh, terrific. Now, both of you have also got additional roles. You are the chair, John the chair, and Violanda the vice chair for an organization here at CDC known as the Surveillance Science Advisory Group. Can you tell us a little bit about what that group does and how it impacts surveillance here at CDC? Why don't we start with Violanda first?
The group has a history and is a cross-cutting surveillance group. Membership is diverse, and I think that's the beauty of this work group, to allow collaborations and relationships among different members having different expertise to use their knowledge to create relationship with other colleagues and to actually facilitate the leverage of these resources the organization has to promote and enhance the practice of public health surveillance.
Terrific. And John, as chair, where do you want to take the organization in the years to come?
Well, I see we have two main pressing opportunities that we need to work on. The first is we need, as much as possible, to be aligned with CDC's surveillance strategy. And also, we need to take advantage of collaborative opportunities, as Violanda was mentioning, whether that means working with other groups at CDC who focus on surveillance or other groups who don't focus on surveillance but need our skills to help them meet their goals.
What do you both think are some of the biggest challenges you face in doing surveillance, and whoever wants to start? So.
Okay. Well, I would say what is most often a challenge for me is to make sure that we focus on using public health data for local public health action. And what I mean by that is we're in an era now where surveillance is very complicated. There's a lot of demands, there's a lot of interest that surveillance data is as best as it can be in our surveillance systems, and there's a lot of new technologies and innovations. So it's easy on occasion to get overly focused on the process of surveillance, but I think it's important that we always are focused additionally on the ultimate outcome and impact of using data for local public health action.
Yeah, that does sound very important. What about you, Violanda? What do you think about it?
Well, I obviously agree with John. We have been talking about surveillance, SurvSec future actually. But again, I will highlight this important idea of having this cross-cutting generic use of surveillance in this group, which I think is important given that surveillance is the foundation of CDC work, and how this group could actually facilitate this kind of conversation and relationships, given in these days coordination, collaboration, and partnerships play an important role.
So it sounds like where you want to take SurvSec is to really give a voice to many of the working staff who are doing surveillance and connect them and network them more.
Yes.
And that sounds like a real opportunity here at the agency.
Right.
Longer term, what do you think are the big opportunities for surveillance in public health? Violanda, what do you think?
I think the healthcare reform actually created for us a new way of looking at surveillance. And as I said before, I always have been interested in the cross work and collaboration between healthcare and public health. And I think these are the times that offer us the opportunity to closely integrate public health within healthcare system, to take advantage of the informatics and all technology available to us, and to improve, to enhance the way public health surveillance has been helping public health all the way through all these years.
Yeah. So, John, what about you?
Well, I would say related to that, the future that I see is on a routine daily basis, all of these collaborations occurring, whereas now they tend to be more special projects, but I would like all of this to happen in a very natural, routine, day-to-day occurrence.
Terrific. And it sounds like ServSAG has a really bright future with your leadership. So thank you for being with us, and thank you for your leadership in ServSAG. And thank you for joining us today on another installment of Conversations in Public Health Surveillance.